So, Kim, I am a psychiatrist and I work with many patients suffering from depression, anxiety, and other mental health issues. And being a psychiatrist, I prescribe medications to them. So, how can shadow work help people with anxiety, depression, or other mental health issues?
Yeah, very
Yeah.
good. Most anxiety and depression can be resolved with psychotherapy. Now, there are
Mhm.
some biologically driven ones that you just need some medication for help.
Mhm.
Okay. So just honoring that whole being, because we are biological beings, but we are also psychological and social beings. And so to the degree that the anxiety and the depression is triggered by or manifested by psychological and environmental orientations, we can heal those.
Mhm.
So, an example would be maybe you can actually create depression or anxiety in yourself just by simply thinking, oh, life is so hard. Life really sucks. Man, this is so hard. Oh, I'm just so stupid. I'm so bad. Now, if I keep thinking that over and over and over, I will create depression in my life. And in shadow, we may have felt those messages from parents or siblings or classmates or something. They gave us messages that we weren't like good enough in some way. But then our unconscious mind keeps repeating those. We might not
Mhm.
even notice it consciously, or we might. But the point is, the message keeps repeating, and that will induce depression. And it will alter the chemical makeup in our brain. And that's why when we use medicine, we re-alter that chemical makeup back to a more balanced way.
Mhm.
The way to do it another way is to change the psychology. And when we change the psychology, that will also change the chemistry in the brain. I can also induce anxiety just by going, oh my gosh, who's out there? Where's danger? Oh, I notice danger. I always have to look for danger. And if I just keep doing that over and over and over, I will induce anxiety and I will change the chemistry in my brain and my
Mhm.
body to an anxiety state. These can be created because maybe I grew up in a home that had a little bit of hostility in it. And so I always had to kind of be hyper vigilant for, where the next negative thing might come from, whether it be a slap or a hit or a negative comment. And so I kind of start living in this place where I'm always looking out for danger. And then that creates an
Mhm.
anxiety that becomes habitual. Dr. Neil Shah, I know that, being a physician, you know about the
Mhm.
myelin. When a neural pathway is first beginning, it's slow. It's just beginning to learn. But after it's practiced many times, it becomes up to 2,000 times faster. So when we first started learning, that we weren't good enough or that we had to look out for danger, it wasn't running that fast. But now maybe we're 20 years old, 30 years old, 40 years old, 60 years old. We've been practicing that. So now it's
Mhm.
running at lightning speed, 2,000 times faster than than the original time we learned it, automatic mode. So what we want to do is reverse that process and start getting accurate thinking, honest thinking about what's really going on. Start noticing safety versus danger. Start noticing love instead of rejection in our lives. And that
Mhm.
will start altering the brain chemistry. And if we practice it over and over and over, that new pathway will become 2,000 times faster than when we're first beginning to practice it. And that will
Mhm.
alter our brain chemistry and it will help heal depression and anxiety.
So, Kim, that was really insightful and a new concept for many of our audience. So, Kim, can you share a story of a client with whom you work and like who resolved depression, anxiety, or other mental health issue with your shadow work?
So I've worked with a lot of depression and anxiety. I can pick depression.
Mhm.
40-year-old woman who's been
Mhm.
on psychiatric meds for 10 years and working with her around her depression. At first, I had to get the meds reduced a little bit because the
Mhm.
meds were so high that she couldn't think clearly. It
Mhm.
helped manage her depression, but it also kept her from having the skills to process her depression in a way that she
Okay.
could heal. And so I had the meds reduced a little bit so that we could, not a lot, but enough that we
Mhm.
could start using her mind a little bit. And then with that, we could start doing some shadow work about where this depression comes from. Some of it came from her current husband. Some of it came from early life experiences. And we started healing those. And
Mhm.
as those healed, then the depression started lifting some, and we could reduce the meds even more. And then as the meds were reduced, she had more conscious capacity to process more depression. And so
Mhm.
this was a long-term process of a couple of years in this case, because it was very severe and the meds were so high just to keep her from committing suicide that we had to
Mhm.
be very gentle about it. You don't want to just take somebody off meds. That can
Yes.
lead to suicide, right?
Mhm.
So sometimes you have to be very gentle about that. A slight reduction, increase the coping skills. Slight more reduction, increase the coping skills some more. Slight reduction.
Mhm.
By the end of a couple of years, she was off her meds. She was happy. She was hiking. She was doing photography. She was doing all kinds
Wow.
of things. Now, there were times where she still struggled, and then she had kind of like meds that she could go on kind of just to help her for a little bit until she could get back over it. So it wasn't a complete healing in this case, but this was a very, very severe case that I
Mhm.
wanted to bring up because there's other cases that,
Mhm.
were healed in just a few sessions.
Mhm.
Those are easier cases. But sometimes there's very difficult cases, but they can still get a lot of benefit, but it's just a very tender process that we go through. And
Mhm.
sometimes stressors would go up, so we'd have to increase the meds again a little bit. And then as we got the coping skills working, then we could reduce them again.
Wow, Kim, that was absolutely an amazing story. Like a patient with severe depression who wanted to commit suicide, like you were able to reduce her meds, and with psychotherapy, like she was like how she was before. So that was absolutely amazing, Kim.